Hello, everybody. Welcome to the UCAT webinar. Great to see so many of you on the call. So let's get going then. What have we got for you today? We've got a webinar called UCAT, the concoction of reasoning and judgment. Now, why have we called it that? I think all will become apparent as we go through the webinar. So let's see, who do we have with us today? So my name is Parul. I am the founder here at the Oxbridge Formula. Now, a lot of you might think, oh, this is made by the Oxbridge Formula, but I'm not planning to apply to Oxbridge. Is this still going to be relevant to me? Yes, the answer is absolutely yes. While a large majority of what we do is Oxbridge preparation, we also have a significant number of medical applicants and we do a lot of medical help. So you are very much in the right place. Do not worry at all. Just to give you a bit of background about me, I graduated from Oxford a number of years ago with a first-class degree, and then set up this organization because a lot of the time when you're doing applications, the person who is teaching you hasn't gone through, or the person who's guiding you through the process isn't somebody who's gone through that process themselves. If you are here for dentistry, absolutely, it's still completely relevant to you. I'm completely, sorry, I've completely forgot to mention that. Our UCAT program is UCAT only, so very, very relevant to dentists also. So yeah, just to then became a teacher, right? And I realized that while schools are really good at doing that medical application help, ultimately, like, it's very unlikely that any of your teachers are actually medics, that they're doctors who have actually gone through the process and have come out the other side. Can I just make a quick request? If you have any questions, guys, do not put them in the chat. Instead, if you can put them in the Q&A box, we will come to that at the end. So if I can make a gentle request to not put it in the chat and to put it in the Q&A instead, that would be fantastic. I then wanted to introduce you to Chris. Chris, if you say hello to everybody.
Hi, everyone.
So Chris is our lead tutor here at the Oxbridge Formula. You're going to see how he is able to take very complex seeming things which seem tricky and difficult to understand. He's able to really simplify them and get you to understand things in a much more easy way. So thanks very much, Chris, for being here. We've then got Abhishek. Abhishek, if you just literally unmute and say hi to everybody.
Hi, everyone.
So Abhishek is a current medic at Oxford. So he is one of our tutors here at the Oxbridge Formula and has helped lots of the students, loads on our group program, but also many individually one-to-one as well. So we're really grateful for him being here. They've actually kind of got exams at the moment, so super grateful that you were joining us. And then Jenny, if you want to say hi to everybody.
Hello, everyone.
Okay, Jenny is, if I'm not mistaken, a surgeon medic at Oxford. Yes, and again, one of our tutors. So yeah, it's really great to have everybody on this call. There's a lot that you can ask. As I said, if you have a question, put it in the Q&A. We'll be doing Q&As at the end. Also, lastly, I'd like to introduce you to Jansu. She's our UCAT consultant. Jansu, if you want to say hi.
Hi, everyone.
We do offer some UCAT help beyond just this webinar, which we'll be touching upon at parts today. There's going to be a lot of information that we're going to be giving you anyway. But if you do want to find out more, there'll be the opportunity to perhaps have a call, and that call will most likely be with Jansu or myself. So let's move on to the next slide, please. Okay, so what are we going to be covering today? So firstly, what is the UCAT? And who has to sit the UCAT? So that's gonna be the first thing. Most likely all of you know you have to sit it, which is why you're here, but it's still good to go through. Secondly, what score do you need? Now, it's not always super clear cut what kind of scores universities are looking for, so we're going to explore that in a bit more detail. Then we're going to be looking at why the UCAT is actually as challenging as it is. Like, what is it about the UCAT that makes it challenging, that makes it tricky, that means that you've got to dedicate the next few weeks or months to really preparing hard for it. Okay, number 4, we're going to be going into firstly, we're going to look at some UCAT questions, and we're going to talk about how we can do them fast. Now, we will not be able to cover every single style of question today, which, we are able to cover a lot more when you come and work with us, but we'll be giving you a taster of how little tips that you can use for these questions. And that's something that you can go and action straight away, which will be really cool. And lastly, how should you prepare for the UCAT after this today? So let's go without further ado to what is the UCAT and who has to sit it. At any point, if somebody else is meant to be talking on the slide, I can just get carried away. Feel free to unmute and just speak. So the UCAT, what does it stand for? It is the University Clinical Aptitude Test. And look, we said earlier, what does it test? It is a concoction of reasoning. There are 4 sections in the UCAT which test your reasoning abilities. And there is 1 section testing your situational judgment skills. And that's essentially what it's teaching. And if you're like, oh my gosh, what on earth are you talking about? We'll be going through all of that in a little bit more detail very soon. Okay, now who has to sit the UCAT, right? Most universities in the UK, and actually some universities abroad, I believe Australia, New Zealand as well, ask for the UCAT for medicine and dentistry applicants. Some universities use the BMAT instead. This is also an aptitude test, but you can think of it as being more academic. It tests, science knowledge, maths knowledge, and essay writing skills. Whereas a UCAT is a lot more, as I said already, reasoning and judgment based. You can take both the UCAT and the BMAT. It's highly likely that a number of you, those of you who are applying to medicine, will be doing a mixture of the UCAT and BMAT. And the scores that you get in the UCAT and BMAT are sent to universities after you apply, right? So the universities don't find out your scores beforehand, but when you apply, they get sent your scores. Okay. Chris, do you want to go?
I think I'll just say about this, we're going to look in more detail at which universities use UCAT and how they use it later. But this is just a list of all the universities that do for medicine and related courses or dentistry and related courses. But as I say,
there's a lot of unis there. Just have a quick scan if any of the unis you're interested are on there. Okay, let's move on.
So maybe if I talk about the format of the UCAT a little. So you have, it's a 2-hour test, but there's 5 sections, as you'll see at the bottom, and the time for each section is fixed. So you don't get to choose how much time to use in each section. It just moves on for you. It's not a paper test. It's taken on a computer at a testing center. There's a special interface for the UCAT, which you kind of have to learn to get used to as part of your preparation. To help you answer the questions, you have laminated paper, basically an erasable whiteboard. You can do working on and then erase and do more working. You also have an on-screen calculator. So in the app that you're taking the test in, there's a little calculator tool you can open. It is apparently a little bit tricky to use for some people, but that's what you're given. You don't choose what questions to take. You just get given a number of questions per section, as shown at the bottom, which I'll talk through in a second. And there are 5 sections. So we'll look at each of these in more detail later in the webinar. But just to introduce them quickly, so you've got verbal reasoning. So that means reading skills, you've got to read a passage and then answer questions on it and inference from that passage. You've got decision making, which is actually quite a broad topic. You ask what you can and can't conclude from things like graphs or, again, passages of text. There's also some not quite mathematical, but maybe logical thinking involved, so things like Venn diagrams and probability. There's quantitative reasoning, which is basically maths, so maths and data, and doing quick calculations. That one you'll definitely need the calculator a lot for. There's abstract reasoning, which you kind of have to see to understand. It's about identifying patterns and trends, as it says here, but the format is very unique to UCAT. So maybe when you see some questions, you'll kind of get the idea of what they ask you to do in that section. And then there's situational judgment at the end, which is, as Paul said, that's the judgment section. So you're faced with some potential real world scenarios, things you might face as a medic or a dentist or another professional, and how should you react in those situations, or what's important to consider in those situations.
Okay, very good. Thank you very much, Chris. What have we got next? So let's think about the logistics then. Chris, were you going to talk about this one?
Yeah, absolutely. So as I said, you go to a special testing center to take the test. You have to figure out which one's closest to you. You have to register online in order to be able to take the test.
I just want to add to that. Basically, if any of you have done your driving theory test, it's the same test center where you do your driving theory that you will do a UCAT.
It's probably a surprisingly similar experience, actually. So yeah, you go to this testing center, you sit at the computer, you take the test, and then they actually give you your results on the day. We'll talk a bit later about why that's important. There is a fee to pay, but there are bursaries available, and sometimes schools cover it, sometimes they don't. You can, when you're registering online, you can actually choose your test date from around the middle of July to the end of September, and the dates will be, exact dates will be available online. We suggest for our students, it's better to take it earlier in the year, at least before around mid-August. And that's because the UCAT isn't the only part of your application. Firstly, you have to submit your UCAS application, so your personal statement, like all the work experience you're doing in preparation for that. Also, you can apply for some unis that use UCAT and others that use BMAT. In fact, we might recommend it. But the BMAT is taken later in early November, as this timeline shows. So both your UCAS deadline, your personal statement, and so on, and the BMAT you might be taking, those will take place later. So you want to leave time to prepare for those. And if you take your UCAT at, say, the end of September, you've left yourself probably not enough time for the other two. So that's why we suggest our students take it.
And I think I just wanted to add to that. It's not only about the time, right? Because, you know, the summer holidays is a time when you have a lot of time to prepare. As soon as you go back to school in September, it's going to get crazy with UCAS, personal statements, your year 13 course. Like if you like say to yourself, oh, I'm going to do my UCAT mid-September, then okay, you're going to start your BMAT preparation middle of September while you're doing all that other stuff, and BMAT's not easy as well. So yeah, we strongly recommend kind of spending half of your summer doing UCAT prep, getting that out of the way, and then moving to BMAT if you are doing the BMAT as well. Okay.
Yeah, exactly. We could maybe mention interview prep as actually a surprisingly important thing on top of all of that. So let's show a timeline of how you might prepare coming up. So if this is our year, so UCAT, you can start taking middle of July, as we said, and then we suggest taking it in the earlier periods, so around up until mid-August, but you can take it after that as well. And so your UCAT prep, I mean, really, why not start early? You'll see later we discuss maybe preparation timelines for UCAT, and okay, you might do more work closer to actually taking it, but we do suggest to our students to start early. And then that will lead up until you actually take the UCAT. Then the UCAS deadline, as we showed, is in the middle of October. And so everything you have to do for that, including any work experience you're doing and then writing up your personal statement, will have to happen leading up to that. BMAT takes place at the start of November. And you can see for BMAT prep, we've got it going all the way back, and that's because it depends on all your AS knowledge. So you can start preparing quite early. Then if you get invited to interview at any of the unis you've applied to, that tends to start around the middle of December and carries on into next year, depending on the university. Again, you should be starting your interview prep early, but you can imagine it will ramp up as you get closer to interviews.
What score is needed for the UCAT? Now, I think firstly, in order to answer that, it would be good to answer the question, why is UCAT needed? And the answer is because applications to medical school, dental school are just so competitive, right? So here, I think, are we looking, Chris, can I just confirm, we're just at medical applicants on this particular slide?
This is undergraduate medicine applicants, yes.
Okay, this is undergraduate medicine, but the numbers are very similar for dentistry, so don't think we've forgotten you. But just to give you an indication, for the UK, there are 29,000 people who apply for medicine, but there are only 9,500 places. And because of that, like, what does it mean? It means that the success rate is on average in the country around 30%. However, so what does that mean? It means if you apply to medical school, you've got a 1 in 3 chance of getting in. But at some unis, for example, Bristol, which also requires a UCAT, the success rate is only around 20%. So this is highly competitive, right? And I know a lot of medical schools do interview, but if they were to interview all 29,000 applicants, that would be pretty crazy. So what they do is they have this admissions test, they have this aptitude test, the UCAT, to test your skills, so that they can select the people that they want to invite to interview and then do a further stage of selection at that point. Just to also just give you a bit of context, international students, in the UK, there are just over 5,000 applicants with only 500 places. So this is even more competitive with just an 11% chance of success for medicine. And we can find those dentistry figures out for you very shortly as well. Okay, moving on. So that's the reason that the UCAT is used. Chris, talk to us about the UCAT and how it's scored, please.
Okay, so as we saw, there are 5 sections. And the first 4, the reasoning sections, are scored differently to the last section, the judgment section. So if we just show the different sections, these first 4 are all scored. You get a raw mark. There will be some formula they're using which converts that to a score between 300 and 900. Exactly how that's done will depend on the year. So you get a roughly similar distribution year on year. And then that means your total mark for those 4 sections is somewhere between 4 times 300 is 1,200, 4 times 900 is 3,600. The mean score is, by design, typically around 2,500. It does go up or down a little bit each year, but it's normally around that number. And then this last section, the 5th section, is kind of graded separately. You're given quite a granular grade, sort of like a course grade from 1 to 4. So it's just 4 grades. There's 1, 2, 3, 4, and 1 is the best and 4 is the worst. And the mean is bang in the middle. So on average, people are getting 2s and 3s, but you want to be getting a 1. If we look at this in slightly finer detail, so this graph here is showing the minimum score you need to be in, say, the top 10% or the top 20% and so on. So to be in the top 10% of all applicants, and these numbers are roughly similar year on year because that's how they design the score conversion. To be in the top 10%, you have recently needed to have around 2,850 as your score. And we'll see in a second, some universities have higher UCAT cutoffs, not necessarily cutoffs, but have higher UCAT expectations than others. And this is the kind of score that would get you into the most selective universities for UCAT. Also, as we saw before, the success rate for applying to any individual medical school is around 30%. So it's not exactly that you have to be in the top 30% of candidates to get in, but it might be a good indication if you're on track. And to be in the top 20%, you need 2,730, top 30%, 2,640. And you can see the numbers just drop towards the mean value of 2,500 here. So if you get that, you're in the top half, but it's not really as impressive as getting numbers up here.
And just to quickly sort of say, so 2,850, we're roughly looking at getting just over 700 out of 900 in those 4 sections, those first 4 sections of the website. And we've just done a bit of research. So dentistry, we're seeing numbers like 1 in 15 in terms of how competitive it is, again, so extremely competitive on those. And again, another reason why they're using this test. Okay, Abhishek.
Yeah, so strategic applications. This is when you kind of use your UCAT results to kind of suss out where you're most likely to get an interview, and as a result, where you're most likely to get an offer. So as the timeline shows, your UCAS deadline is on the 15th of October. So for those of you who don't know what that is, the UCAS deadline is when you have to send off your applications alongside your personal statement to the universities that you choose. But as you can see, the BMAT takes place in early November. So you won't actually have your BMAT results at the time you send off your applications, which can be a bit annoying for some people because they would like to know what score they have in the BMAT before choosing which universities they want to go to. However, you do get your UCAT results on the day, and the UCAT sittings all take place before 15th of October, which is why you can strategically apply using your UCAT. So let's say you get a really good UCAT score. You kind of know that you're going to likely get an interview at the UCAT unis, and you can confirm this by looking at the applications admissions websites of the whichever universities you want to go to. They usually have some statistics, some may not, some do, of like average scores in previous years. And although this is historic data, like it may not 100% be the same for your year, but they usually tend to be quite similar. So just based off that, firstly, you can kind of suss out if you're going to get an interview or not. And if there's nothing on the admissions website, there's another website called whatdottheyknow.com. And this is where you can ask for freedom of information requests. So to kind of summarize what they are, universities are obliged to give the most information possible about their admissions processes. And this is mediated by the freedom of information requests. And in the past, there will be many people who use this website to ask universities about stuff like this, about average UCAT scores in a particular admission cycle. And this will all be freely available on this website. So you can go and search up any questions that you have. And usually there will be people who've asked this before and the unis will have responded. So just based off that, you can kind of see what average scores of the people interviewed, what they had, average scores of the people who got offers, what they had. And if this matches up to your UCAT score, you may have a good chance of getting an interview. And so, yeah, however, if your UCAT doesn't go as well, and you're looking at the scores and it's a bit more unlikely that you'll get an interview at a certain university, then you may be wanting to think of choosing a lot more BMAT unis than UCAT unis, and instead preparing a lot heavily for the BMAT so you can get a good grade in that and apply to a uni that does the BMAT. So yeah.
Okay, thank you so much, Abhishek. So yeah, just to summarize then, you want to use your UCAT score to determine which unis you might apply to, and we're going to look at which universities use the UCAT, well, how different universities use the UCAT in different ways and what kind of scores you might need in just a second. But let's just have a quick look. So as I said, there are different approaches taken by each university. And generally, the UCAT is used alongside your predicted grades and your UCAS application, in other words, your personal statement, in order to figure out who they're going to shortlist for interview and make offers to. Now, as Abhishek said, a lot of universities don't actually publish the cutoffs or the requirements, but you can find some information on some university websites, or as he said, you can do that freedom of information request. Now, let me just give you some examples of how the way that UCAT is used by different universities varies, and it varies quite a lot. So Edinburgh, let's take Edinburgh as an example, right? They typically just straight out reject anybody who has a band 4 in SJT. So they're taking the situational judgment part and really putting a lot of weight on that. And they're saying, if you didn't do well in this, there is no way you can come to our university. On the other hand, okay, another Scottish university, Glasgow, is saying, we don't even take SJT. We don't take situational judgment into consideration at all when we're picking candidates. So if you, for example, were really good or really bad at situational judgment, that might affect which university you applied to. What does Manchester say? Manchester typically only interviews those scoring in the top 1/3 nationally. So you saw that Chris had shown the bars of, if you want to be in the top 30%, you need to get a specific grade, that kind of thing. So Manchester picks based off the top. Warwick rejects anybody with a verbal reasoning score below the national mean in round 1 of selection. So they are wanting people who are showing that they're good at verbal reasoning. And if you know that that's one of your strengths, maybe Warwick isn't one of the unis to apply to. But that being said, you do get your score before you make your application. So you can use all of the individual scores that you get in order to make that decision. So Jenny, can you please tell us, talk to us about the different unis that need different scores and so on.
Okay, so yeah, as Pearl and Abhishek have already said, the most important thing with the UCATs, of course, is to strategically apply and look for what universities would suit your strengths. Of course, actually visiting them and getting the general feel for the university and the location, that's all very important as well. But unfortunately, given how competitive medicine is, considering your strengths is an important part of the holistic medicine application process. So this table here is sort of roughly made based on what each university gives on their website. as to what is roughly the average UCAT score of the successful candidate and how important the UCAT score is relative to other components such as personal statement, the interview, and academic predicted grades. So you can see that there is sort of a shift towards a high UCAT score. So this is essentially showing that UCAT is not something to be neglected. I know you guys are probably all very busy, especially if you're in year 12 with your personal statements, with your mocks, but UCAT, the better you do, essentially, the more opportunities you have and the larger cohorts of universities you can select from. So there are some UCAT universities where you probably would need a very high score to be competitive, and that might be either because they are very competitive in general, such as Bristol, because they have a very high number of applicants applying for few spaces, or they might value the UCAT more than other components. So yeah, this is just a rough overview, and if you want to find out any particular university you're more interested in more detail, they should all have their statistics on their websites, or as Abhishek said, you can also do a Freedom of Information request. And however, this table also shows that even if you don't end up getting a great UCAT score, there are still opportunities available to you. So for example, if you get a low UCAT score, Exeter, East Anglia may not value it as much as these in the very high category value it. And of course, if you don't get a high UCAT score, the BMAT is another opportunity where you can potentially do well and open up what is available to you. So just to give this example of how to sort of strategically use the UCAT and to choose universities, for me, when I was applying, I actually really wanted to go to BMAT unis. So I applied for Oxford, Imperial, UCL as my BMAT unis because I really like the sort of science aspect. But I knew I needed to do UCAT as well and apply for UCAT universities because, as Abhishek said, you don't actually get your BMAT scores before you apply. So that's quite risky. So I did the UCAT and my score was 2,110, which, and then I looked up what that score would be sort of most competitive for. So I chose Edinburgh because at the time when I applied, Edinburgh did an interview and the UCAT formed sort of quite a large percentage of the decision-making process where they sort of ranked you into deciles and based on that, admitted you with your personal statement or not. Now I think they use it to rank for interview. So it's still very highly considered, which is why it's in this category. So I thought that was a safe option for my choices.
Okay, excellent. Just to, I think it wasn't clear, but you got 3,110, which is a phenomenal score. Well done. I think I just wanted to say, like, Jenny said that, you know, if you didn't do well in your UCAT, then you still have BMAT as a chance. But I think what I would say to that is, if you didn't do well in your UCAT, why was that? Was it because you didn't put enough work in? Was it because you left the work too late? So what I would say is, firstly, don't make those mistakes because you only have one shot at the UCAT per year. And you only have one shot at the BMAT per year. So don't make the mistake of not doing well in the UCAT before then you were like, oh, and then the penny drops that you need to do the work for the BMAT. Put the work in. And if you didn't do so well in the UCAT, really analyze what it was that you need to do differently and apply that to the BMAT to make sure that you have as many choices as possible. So if we can move on to the next slide.
I just want to add one thing, which is just because the university is down at this end doesn't mean it's easy to get into. It just means the UCAT isn't a big part of like if they're weighing up the different aspects of your application, the UCAT isn't weighed very highly. They know you're taking it maybe for other universities, so okay, they'll look at your score, but they care more about the interview, your predicted grades. So places like Exeter, St Andrews, they're still quite difficult universities to get into.
Okay, yeah, that's a really good point. Thank you. Just to very quickly give some context, if in, you know, we just talked about BMAT. So the BMAT universities are for British or like for all applicants, Brighton and Sussex, Cambridge, Imperial, Lancaster, Leeds, Oxford, and UCL. And if you are applying for Kiel and Manchester and you're an international applicant, then you may also be required to sit the BMAT at Kiel and Manchester. And as we said already, even if you're applying to lots of BMAT unis, it's really like useful to have a good UCAT score, because your BMAT isn't done until after you apply. So if at least if you have a good UCAT score and the BMAT didn't go so well, you know you have some choices. So yeah, it can be good to do both. Right, let's talk about what makes the UCAT so difficult. Okay, so I think, is it Abhishek? Are you talking to us about this?
Yeah. So the UCAT, as you can tell, I guess, it's quite a difficult exam. And there's a few points that students usually all seem to find quite difficult. So I'm going to mention some of those few points today. So firstly, I'd say timing. That's personally what I found was the main issue with the UCAT, as well as many other medical students. And so, as you can see, 225 questions in 2 hours seems like an insane amount of questions to cover in that short period of time. And usually, people don't end up finishing all the questions, which leads them to having a lower score than they would have expected to do. And so this is something that in our UCAT course, we'll be working on getting you guys to speed up in your questions, getting them done as soon as possible and as efficiently as possible. Secondly, problem solving. So some of the UCAT sections, they involve a lot of problem solving skills, stuff that you don't really cover in school. It's not your typical like math sort of questions or reading stuff. There are some sections that do use skills that you've covered in school, which some people do tend to find a bit easier, but sections like abstract reasoning or decision making, which we will cover a bit more in a few minutes, they use a lot of problem solving skills and a lot of skills that you aren't really familiar with using right now, which is why some people take a bit of time to get used to these sort of questions and to get good at them, because it's a bit unnatural when you first start. So thirdly, the UCAT interface can be a bit of an issue for some people because it's a totally online exam. And it, as you can see on the screen, questions involve like loads of different things you need to get used to. So there's a flagging system, there's keyboard shortcuts, and there's a timer that you need to keep aware of. And the more practice you do, you will get used to this UCAT interface. But that is something that some people do find difficult to get used to, because right now I'm guessing you guys are all used to doing exams on paper and handing them in as opposed to doing online exams. So that's something that people do need to get used to. And finally, the length of the exam itself. So the UCAT is 2 hours long, but you can't really take breaks in between them. You only get 1 minute breaks before each section. So that's only what, five minutes breaks throughout the whole exam, 2 hours. And any other breaks that you want to do, so if you want to go to the toilet, that's going to come out your exam time. And obviously, since it is so time pressured, taking breaks like that can make it even harder for you. So in all, these are the main problems that you can face with the UCAT. But in our course, we will also be asking you guys to do loads of mocks and stuff like that, which gets you used to doing exams in 2 hours in the exact exam conditions and gets you like well prepared for the actual exam day. So these challenges can be faced.
And I just wanted to add to that, 2 hours, it might not seem like a long exam because you're probably used to doing 1.5 hour, 2 hour exams, you know, just with uni, but with the intensity of doing 225 questions in 2 hours, that is intense concentration that requires. That is intense brain work that you're using during those 2 hours. So it is a very intense feeling exam. I just wanted to add. Yeah.
And one other thing that's actually reminded me. So as you guys remember from the structure of the UCAT, one of the most time pressured sections is abstract reasoning. And that usually comes near the end-ish. And at that point, as you can imagine, doing 2 hours straight of exams, you're going to be quite tired. You're going to be a bit mentally drained. And when you get to a whole new section, you have to do really good in this section as well. And then that's just, it drags on, which is why doing practice in exam conditions is so important for this exam.
Okay, fantastic. Thank you very much, Abhishek. Okay, moving on.
I just want to add one thing, which is if you do have extra time in exams, normally there is a separate UCAT for people with who need extra time or other accommodations. You might ask your school about that for advice.
Okay, excellent.
Okay, I've just got this graphic here talking about the skills you need for the UCAT. So these three at the top, the ones in pink, are kind of universal. Those apply in lots of sections, well, in all 5 sections. So there's time management. As we said, it's very time pressured. You need to read actively. So if you just stare at the screen and expect the meaning of the words or pictures to come to you, you're not going to get very far. So you need to think about what you're doing when you read, which can include reading images. And you need to be able to work under pressure, because since it's time pressured and it's a very important exam and a lot of the questions are quite difficult, you're going to feel under pressure. But this one you need to get used to in timed mocks and then apply in the real thing. And there's a number of other skills, some of which are specific to individual sections, some of which come up in a couple of sections. But we'll discuss these more when we come to the sections they're especially relevant for.
Okay.
Because there's a lot of skills being tested here.
Yes.
It's a diverse exam.
Okay, excellent. All right. So yeah, there's a lot there that you need. So let's just take a look at how we're going to use these within the individual sections. Next slide.
Wait 1 sec. I might need to restart the presentation.
Okay, all right. Well, it seems like we've had some technological issues, guys. So while we are waiting for that, could you please put in the chat to me, what is the #1 thing you've taken away from today so far that you're going to really think about, or is going to help you with your application or your preparation? Put it in the chat to me now. One thing that you've taken away so far that you're like, this was super helpful. So somebody says how to manage my time, that time management is key, the amount of skills needed, that you should start preparing early for the UCAT, that UCAT, you should get a lot of UCAT style practice, which unis require it, what scoring, how scoring works, how to strategically use the UCAT, practicing in exam conditions and how important that is, the fact that there are a lot of skills required, how the scoring works, exam conditions, using the UCAT score strategically, how to plan for the UCAT and BMAT exams, absolutely. Any more? The fact that you need to answer 200+ questions in under 2 hours, yeah, that's pretty intense. The skills required, the fact that you need to spend ample time on revising and preparing for the exam. I'm glad that if that's the thing that you've taken away today, then that is really, really, really good. Chris, if you are having tech issues, would you like me to try to share? I'm
just about to share, so hopefully this
fantastic.
will move between slides.
Excellent.
Yeah.
Okay, so now we're on the section on how do we actually answer these questions, and what are tips and tricks that we can use to get fast and accurate. Chris, talk us through verbal reasoning very quickly.
Okay, so verbal reasoning, you've got 44 questions in 21 minutes. So less than 30 seconds per question. It's testing, again, all of them test time management, but this one also reading skills. You have to read quite long passages in a short amount of time, which is why we're going to suggest maybe you don't read them in depth. You'll have to practice reading quickly. And you also have to, it is a reasoning test. So it's testing your ability to draw accurate and supported inferences from the text that's there, not make assumptions, not misunderstand the text. So your 44 questions are, you have a number of prompts. You've got 11 prompts, and there's 4 questions per prompt. So fortunately, you don't have to read like 44 pages of text, only 11 pages of text. All the questions are equally weighted. And this section turns out to have the lowest mean score of any section. The mean score is less than 600. So in a way, that means in this section, okay, on average, candidates find it hard, but it does mean it's also one of the best places to differentiate yourself from other candidates. If you can get good at this section, it's going to boost your score in a place other candidates aren't managing to boost theirs. Let's do a quick snapshot of the kind of questions you'll get in this section. So firstly, what kind of passages do you get? This is one example. This is about brazing and welding. So, okay, a lot of the passages are about maybe technical subject matter. Often they're introducing you to stuff you have no reason to particularly know about. If you're applying for medicine, you shouldn't need to know about welding. And if you do, it doesn't really matter. It's not about your subject knowledge. It's about what you can draw from the passage. This one, I mean, it looks like a decent amount of text. This is actually one of the shorter ones because the longer ones wouldn't fit on the slides. Here's another one. So you can see this is quite dense. There's lots of acronyms. This is about research in education. So you've got to take on a lot of technical knowledge in a short period of time. We showed the kind of questions you could be asked about some of these things. So these are all taken from different questions, so not referring to the text on the screen. But some, like one question type is, you're given a statement, and based on what's been said at the passage, is this true or false, or can you not tell from the information in the passage? So it's not as easy as does it just sound true or does it sound false? You've got to really think, okay, do I have enough evidence, enough information to draw this conclusion from the passage? That's why it's a reasoning test. Some things are just test your comprehension, so which of these things is or isn't mentioned. So that's where quick comprehension matters. Again, like interpreting what the writer's saying. So according to the passage, which of these things is true or false? In that case, false. Again, like the reasoning aspect of it, what can you infer from the passage? So, so this passage would be about English language tests, and you got to figure out again, like what is there enough evidence for in the passage? Not just what sounds true, but what is actually supported by the passage. Sometimes you've got to think about what the writer's opinions and aims are, so almost like critical thinking. So, for instance, what's the aim or main argument of the passage? And here's another example. So, which of these is a summary of the author's argument, essentially? So you can see there's this mix of understanding the passage quickly and also drawing supported conclusions from it. And then to look at the skills that are key in this section, we've got the universal 3 skills here. Identifying keywords is very important. That's something you'll need to do in this section. Hopefully, when you signed up to this webinar, you would have received a handout, a short PDF handout, with some example questions, and those were from the verbal reasoning section. We said, think about what the key words might be. So if you've got to pick out some words in these questions that you might look for in the passage to help you answer them, what would those be? That's what you got to do very quickly in the test. It also tests things like inference, logic, critical thinking, drawing conclusions. So as I said, like what might be supported by what's in the passage. So it's going beyond what's explicitly there, drawing your own conclusions, and also avoiding assumptions. So your conclusions, whatever conclusions you draw, have to be well supported. They have to actually be based on what's in the passage and not your own background knowledge or your assumptions about what you think the writer might have meant, what they might think. You've got to base it on what they actually say. So what we're going to do is we're going to give you 1 prompt and 4 questions, which is the format in the UCAT. And okay, how you divide your time is up to you, but we do want to look at the questions one by one. So what we're going to do is we're going to suggest that you'd have maybe, so for 4 questions, you'd have a bit less than 2 minutes. So we're going to divide it up like this, which is a pretty typical way for students to do it. 15 seconds to skim the passage, get an overall understanding, and then you'll have 25 seconds per question to look at the question, figure out what in the text you need to answer it, and then answer it. So I'm going to give you just 15 seconds here for the quick skim reading. So get ready to do that. All right, 3, 2, 1, here we go. Okay, I'm going to move on. So you will see the passage again when you actually answer the questions. But we're going to have 25 seconds for each of these. So we'll give you some time to answer it yourself, and then you'll see how we would have answered it and some little tips we have for answering each kind of question. There's going to be 25 seconds. There's going to be a timer. So when the timer starts, how I go to the question, I've labeled the options. So I think A, B, C, D, E. So put your answer in the Zoom chat to us when you think you have an answer, and then we'll see what everyone's opinion is. Okay, so I'm about to start this one.
Okay, put the answer in the chat when you're ready. Okay, time is up, guys. So we have a large mixture of questions. We've got D, A, B, last one, B, C, D, number one, that's A, C, okay, a range of different options, right? Somebody's question was, if you skim it, how are you meant to kind of remember the information? So Chris, while you're answering this, maybe if you could answer that question at the same time as well.
Okay, yeah, let's look at how we could actually go through answering this. And so that 15 seconds at the start was just a skim. It was to get an overall idea of, okay, what's actually in this passage. When you see the question, then you're going to have to decide which bit to read in more detail. Depending on your reading speed, you may be able to actually read the passage in the whole passage in some more depth and extract the information, but lots of candidates can't do that. So this technique is a bit more universal, where even if you're a slightly slower reader, you should be able to get the answer based on this approach. And that's, okay, we'll first note what the question is actually asking, and then we'll just look for some key terms that tell us which bits to read. So, and these are techniques we go through in more detail in the summer course, but this is just a taster. What is the question actually asking? It's asking what can be concluded from the passage. So it's one of those ones where you have to draw a conclusion. It's not something that's going to be explicitly said already. And well, maybe I could ask in the Zoom chat again, what word in the question do you think points out which part of the passage we're looking at? So what's the main key word to begin with that points out which part of the passage we should be reading? Okay, lots of people saying Prevnar, which is good. It does tell you the statements are going to be regarding Prevnar. So they give you this hint, look at the part of the passage that's related to Prevnar. Where does that come up? It's in this paragraph. So it's paragraph 2. And we'll look at it. We'll look at where it introduces the name Prevnar. What it says about it is a vaccine for the prevention of pneumococcal infections. Okay. So we'll bear that in mind when we're answering these parts. And at this point, since we've identified this is the passage to read, we'll look at this one in more detail. So it says Pfizer produced Prevnar, a vaccine for the prevention of pneumococcal infections. The introduction of the original 7-valent version of the vaccine in 1999 led to an impressive 75% reduction in the incidence of pneumococcal infections among children in the United States. An improved version of Prevnar, providing a coverage of 6 additional bacterial variants, was introduced in early 2010. So reading that, you might actually just recognize which of these is correct. But if you're going through them one by one to see if they're accurate to this passage or not, let's look at what it says about each of them. So A and B, they talk about similar things. They're both talking about how does this relate to pneumococcal bacteria or infections. And that is relevant to Prevnar. We can see that in the passage. What's the difference between A and B? So when you've got two things talk about similar things, you want to look at what different words they have to distinguish them, not just what they have in common. And A is saying Prevnar can be used to treat these individuals. And B says it's a vaccine, not just a vaccine, but the safest and most effective. So let's think about those in turn. We do know it's a vaccine. If it's a vaccine, is it used to treat individuals who have the infection already? Probably not. Vaccines are normally preventative. So it seems like A isn't going to be correct. And okay, that is using a bit of background knowledge, but it never talks about treatment in the passage. So in the context of a verbal reasoning question, we know we shouldn't conclude A. B, okay, it's a vaccine. Is it the safest and most effective? Well, that's very strong language. That should make us suspicious. And it doesn't compare the vaccine to any others in the passage, so we can't conclude this. We know it worked in one case, can't compare it to other vaccines. C, so C and D are also kind of a pair like A and B are. The C talks about the improved version, which the passage said was introduced in 2010, and D talks about the original version from 1999. So C says the improved version covered 12 bacterial variants. It only talks about bacterial variants once, and it says it covered 6 additional ones. You might interpret this as saying it originally covered 7, or it says it was 7-valent, but A, that's not explicitly in the passage. You'd have to interpret that. And B, 7 plus 6 is 13, not 12. So, okay, C is not the answer. And so it better be D, but we actually just saw it led to a 75% reduction in infections in children in the United States. So the this is quite specific. It has to be children, it has to be in the United States, but those match up. So it's another kind of key phrase. Okay, we look for where there's children. Okay, it's in this passage. And then we see, yeah, there was a 75% reduction in infection rates. So D does actually follow from what was said. And that's our answer to this one.
So just to say, like, some people might be wondering, oh, well, that took quite a while to explain, but I think what we were doing it slowly to explain to you our thought processes. But once you do lots and lots of practice, you're like, okay, what's common about those and what's different? What's common about those? What are these keywords? Boom, 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 boom. And you have to try and do it as quickly as possible. Like, you just have to.
Yeah. So we gave you 25 seconds. I think you could identify Prevnar almost immediately and locate this passage and read it. That might take you 15 seconds. And then you've got to look through the keywords here, but you're having understood this. Okay, I explained in detail how I knew what you can conclude, but you knew it did reduce infection rates and none of these other things had come up. So you, once you have read it, you can conclude D.
Okay.
Okay, we're going to do another one. So I'm about to start the timer. Just get ready to do this question.
3, 2, 1, go. Put A, B, C, or D in the chat. Okay, time's up. I'm getting a mixture of C's and B's, Chris. What's the right answer and why?
Okay, so this one, firstly, we'll just quickly say what question is it? Okay, so just ask this to identify a drug. So it's one of those ones where you just have to identify the information in the passage. Unfortunately, it does talk about different drugs all the way through, but it gives us another kind of keyword we could pick out, which is this is about lung inflammation. So there's almost two keywords. There's lungs and there's inflammation. And they've been a bit mean to you because if you start by thinking, well, lung is a specific word that could relate to a specific part of the passage. If you go through looking for anything about lungs, you won't actually find it. But if you start looking for things relating to inflammation, you might not find the word inflammation exactly, but you find a closely related word, which is anti-inflammatory. So maybe we're looking at this passage. Okay, what sentence has this in? It says, other important drugs include azithromycin, and also, I'm going to pronounce this celecoxib, I don't know 100%. So it says the former, that's this one, is an oral antifungal medication. And it says the latter, that's celecoxib, is the anti-inflammatory drug. Okay, we decided the answer is C. Now you do have to understand what's referring to with former and latter, so they've used a slightly complicated sentence structure to try and get you, but we found the right answer. Okay, we're going to do another one, our third of 4 questions. So get ready to answer
3,
another.
2, 1, go. Okay, time's up. Answers in the chat, please. C, B, C, A, B, A, C, D, C, B, A, B, C, D. Okay, I'm getting all of them. All of them. Let's see, Chris, what's the answer and why?
Okay, so firstly, what's the question type? What is the author most likely to agree with? So firstly, this is another one where you're kind of drawing a conclusion. It's not necessarily going to be something the writer explicitly says, but you might have to just pull it out of what they are already saying. And it's most likely, so there are multiple things maybe they could believe, but which of them is made most likely by what they've said? Basically, what is their actual strong evidence for based on what they've said? And in terms of key words, which parts of the passage should we read? Well, it says there's statements about penicillin, so we'll look for the part that's about penicillin. And that comes up twice in this paragraph. So we're looking at this paragraph. It's worth just noting at the very start, it already talks about fermentation technology. That's so that suggests you might want to think about the option relating to fermentation. And if we look at the sentence where penicillin is introduced, it says the company developed expertise in fermentation technology as a result. That's sort of what they were doing before. So we could go back and read what they were doing before, but I'll just start with the bit that immediately precedes where penicillin is introduced. And it says this technology was applied to the mass production of the antibiotic penicillin. Okay, so we've seen that fermentation technology is then applied to mass produce penicillin. And that kind of points towards C because it refers to fermentation. It says, okay, it allows penicillin to be produced en masse. That's basically what this highlighted part is saying. So it looks like, with those words matching up, it looks like C is correct. I am going a bit faster now than in the first question, by the way, because we're addressing some of the key points. If we did want to think about why A, B, and D aren't correct, it talks about manufacturing citric acid, but not using it to manufacture something else. It does say penicillin was manufactured during World War II, but not that that's when it was first manufactured. So they applied their fermentation technology to produce it then. It doesn't mean there wasn't any other way of producing it or that no one else did it before. And was there a shortage of penicillin in the 1940s? Well, maybe during World War II, like if they needed to mass produce it, you could maybe infer there was a shortage beforehand, although it's not certain. But also the 1940s extends beyond World War II, and they say that it became very expensive in the 40s afterwards. So probably there wasn't a shortage. So we're going to go on to the last of the 4 questions. So get ready for the next one. 3, 2, 1. Here we go.
All right, time's up. Time's up. And in the chat, Chris, most people put C and D with, I see a couple of A's and B's, but most people put C and D. So what's the right answer and why?
Okay, so firstly, let's identify what the question's asking. It's asking for an adjective that's not suitable. So it's worth just noting there's a negative here. Sometimes they don't ask what is suitable, they ask what's not, to make it that one step more complicated. And okay, it's asking for which adjective would you use to describe Pfizer, but a key phrase based on the information in the passage. So whichever of these you choose, it has to be based on what's been said here. Not your own knowledge about Pfizer, but only what the author said. And I think it's worth saying in this one, so remember one of the skills is avoiding assumptions. And typically if you read passages where people are talking about pharmaceutical companies, they're normally not that complimentary. So you might expect the answer to be D because people don't often talk about pharmaceutical companies being charitable. But we've got to think about what's actually in the passage. And actually one of these 4 adjectives is, I'm going to say, unlike the others, and it's actually C, because profiteering is quite a judgmental term. So profiteering means aiming to make excessive or undeserved profits, not just making profit, but kind of with a negative connotation. And that kind of thing is going to be hard to back up, and you definitely notice, I think, if the author was arguing for it. What do they say about profit? They mention profit once, and they say Pfizer searched for antibiotics with greater profit potential. Again, it doesn't mean it was excessive profit or undeserved profit. Lots of companies want to make more profit. That doesn't make them profiteering. It is worth noting here that the verbal reasoning section does test your vocabulary a little bit. So it is that bit more difficult, for instance, if English isn't your first language, but unfortunately you have to know the meanings of the words sometimes. If we just think about ruling out A, so I'm going to suggest the answer is C. Why are A, B, and D suitable things to describe Pfizer based on what the writer said? Well, because they're things the writers backed up, at least to some extent. And actually, you can think of, when I asked you to skim the passage at the beginning, something that's good to do when skimming is just think, what's the purpose of each passage? Like, what's the writer doing in each passage? And if we go through them, the first one's kind of an introduction, but the second one is talking about some success Pfizer had. So a specific thing they did that worked. This third paragraph is talking about their research. So that's kind of supporting them being innovative. And then the last paragraph is talking about them. They provide drugs free for some countries. They provide them at discounted rates to infants and young children. So those are charitable actions. So they are supporting the idea that Pfizer is charitable. So the writer has actually supported A, B, and D and not C. So the answer here is C. Okay, so if we look at decision making, so this one you have 29 questions in 31 minutes. So just slightly over a minute per question. It's testing a lot of skills. It's quite a diverse section, as I said before. So you've got logical and critical reasoning. So what can you conclude from a passage? Kind of similar to verbal reasoning, but shorter passages and more focusing on making deductions. Recognizing assumptions, drawing conclusions, as that could mean not just from passages, but also from graphs or other diagrams. Probability, also going back to logical and critical reasoning, like other more sort of pure logic, and also think about which arguments are stronger or weaker. So a lot of very diverse questions. All the questions are independent. So in a way, although the previous section had 44, there were just 11 prompts. So once you started the prompt, you had a few questions on the same thing. These ones are all completely independent of each other. There are some questions. I'll bring up a small example in the corner. You'll see one in more detail later, where you have, in this case, say 5 statements. And for each of them, you've got to decide, say, does it follow from the prompt you were given or not? So it's not actually just one question, it's actually several in one, which is why those are worth double marks, and you can get half marks if you get some of them right. You may need to use the calculator and whiteboard you were given. So the whiteboard in verbal reasoning could be useful for making notes sometimes, but you definitely need it for working out in the decision-making section. Just to show some question types, here's a probability type question. So it's quite mathematical. You're given a scenario with some cards, 2 contestants are turning over a certain numbers of cards. You go work out some probabilities. So were they equal or not? And also, often the answer is not just yes or no, but yes or no for a certain reason or not. So you're not just going to think what's the answer, but what's the correct reason for that answer. That's why it's a decision-making test. Here's one where you've got to select the strongest argument for a particular conclusion. And it's going to be just based on the structure of the arguments, not factual knowledge. To show some kind of prompts you might get, here's one with a very messy Venn diagram. They like Venn diagrams with lots of weird shapes, and also some numbers which you'll have to interpret. Here's one with a graph that in a kind of science context that you'd have to draw conclusions from. And then looking at some shorter question types, suppose you're given some data, you might be asked which could be concluded, and there'll be a few options, and only one of them is a conclusion you're actually allowed to draw. So only one of them actually follows. Here's a multiple statement type. So not just which one of these 5 things follows, but for each of them, does it follow or doesn't it? And if we look at the skills, this section, because it's so diverse, it covers a lot of skills. You can see all the ones that were for verbal reasoning are actually still there. So identifying keywords, it's still important. You have shorter passages, but you do sometimes have passages. Inference, logic, critical thinking, drawing conclusions, especially drawing conclusions, you also do that a lot. Avoiding assumptions, because you're not allowed to use any knowledge except what you're taking from the prompt, and maybe sort of standard logical reasoning. There was a question, for instance, where it was kind of trying to tempt you into drawing a conclusion because you know that lions are taller than, giraffes are taller than lions, where it had some passage about a zoo, but that information wasn't in the passage, so maybe you're not allowed to draw it. Also, going back, mathematical skills. So you were able to do some working out, especially for probability type questions, and interpreting data. So we saw there was a graph there. They could be bar charts, could be other kinds of charts and graphs. You'll have to interpret and think about what conclusions can be drawn from them. So we are going to give you a couple of questions of different types. So you're going to have 64 seconds for each of these because that's what you get in the test. As I said before, they're self-contained, so you're just going to see a question. You have 64 seconds to answer it and put your answer in the Zoom chat. Are you ready? 3, 2, 1, go.
Chris, I'll put a quick message in the chat as well. Oh, I think the time has stopped. Oops.
Oh, sorry, I clicked off the screen. Okay, you got a bonus 20 seconds.
Right, okay, everyone, I think the time would actually technically be up now. So put your answers in the chats. I'm definitely getting a mixture of A's and B's and D's. No one's put C so far. A's and B's and D's. So Chris, what is the correct answer and why?
So this one, this is a Venn diagram question. The other thing is your answers are Venn diagrams that aren't labeled. So the trick here is to make your own Venn diagram based on this information and then see which of these it looks most like. These statements, they've all got logical terminology in. So we got all sources are liquid, so all, no juices are sources, and the no is a logical term. We've got some and all again. And we've got to think about how to relate those to Venn diagrams. And whenever you have two subsets in a Venn diagram, if we say all x's are y's, so suppose this little circle here is the x's and this slightly bigger one is the y's, then everything that's in the x circle is inside the y circle. So that would correspond to all x's are y's. So a statement like all sources are liquid means the sources subset or circle is inside the liquid subset of circle. If we think quickly about the others, if it says some juices are liquid, that means there's an overlap because some things like these two overlap. So some things inside this one are inside this one as well, but maybe not all of them. And no x's or y's means there's no overlap. So if we just start interpreting these one by one, all sources are liquid, how would we draw that? Well, we'd have a circle for sources and a circle for liquid, sources are inside liquid. And there's another all statement, so we'll do that at the same time. It says all vinegars are sources. Well, that just means there's a little vinegar circle inside the sources circle, so we use that one here. Then we've got two statements about juices. So it says some juices are liquid, so it better overlap the yellow liquid circle, but no juices are sources, so it can't overlap the sort of blue-green sources circle. So it'd have to look something like this, and that means the whole diagram looks a lot like D. Okay, if I'd drawn the juices down here, you would have had to rotate it a bit to get D, but you can see it's the same overall structure. If we just do one more, I'm going to say 3, 2, 1. There's a bit more reading for this one. This one, it might be hard to put all your answers in the Zoom chat, so you can just make a record of them for yourself.
Write one line, which is Y, N, Y, N, Y, whatever you put. Just one line of text, please.
Okay, time's up. And numbering these statements 1, 2, 3, 4, 5, we'll have to, it's a multiple statement one, so we have to decide for each of them whether it follows from the passage or not. And I think firstly, so we had this passage of text. Unlike the verbal reasoning, it's short enough you can actually read it. It's quite dense, so I think it helps to find some way to represent it for yourself. So I'm going to draw a little picture, and this isn't maybe all the information, but it's the overall picture. We're talking about cell division, and there's two phases mentioned in the passage. There's the S phase, and in that the chromosomes are copied and they form sister pairs. And then after that, there's the metaphase, where the chromosomes are aligned and condensed in the center of the cell, and that's when we're told they're normally visible to a microscope. So this picture should help us answer the rest of the question. So 1 sec. I just need to move a window. So let's look at these. And again, like in verbal reasoning, it helps to pick out keywords. So if we look at statement 1, it's about when things are visible. And actually, we see statements 1 and 3 are both about visible things. It actually helps to pair them up and think about them both at the same time, if they're similar statements. So 1 says chromosomes are normally visible under a light microscope. That corresponds to this very first sentence, in their condensed form. So where is the condensed form mentioned? Well, in this passage, it talks about being normally visible when the chromosomes are aligned in the center of the cell in their condensed form, and that's in the metaphase. Is that enough for this statement to follow? Well, the thing is, this is a bit more specific than just they're normally visible when they're in the condensed form. It's in the metaphase. And you don't know from the passage whether chromosomes can be in their condensed form at any other time. You're just told in the metaphase there are. It's also worth noting it says only when. So it does kind of suggest that chromosomes aren't normally visible at any other time, but it doesn't say they can't be in their condensed form at any other time. So I'm actually going to suggest we don't want to conclude this one because we don't know that whenever they're in the condensed form, we can see them. It's also worth noting that in statement 3, it's a bit stronger, and like note the strong language. It didn't just say normally visible, it said always visible, and always is definitely stronger than normally. So we can't conclude this because it's, even before reading the rest of the passage, it's going to be stronger than what's actually there. So the answer to both of these is no. If we look at statement 2, at any given point in the cell cycle, sister chromatids have either 2-arm structures or are metaphase chromosomes. So it's about sister chromatids. Where do those come in? It's in the second sentence. That's in the talking about the S phase. And it's a bit tricky, this, because it looks like it's true. It says they're either an X-shaped structure or a 2-arm structure. And then it says the X-shaped structure is called a metaphase chromosome. So it looks like this is true. But the trick is the X-shaped structures are only metaphase chromosomes during the metaphase. And statement 2 says at any given point in the cell cycle. And it's worth noting that this, again, strong language has got any in there. It also could be like, for all we know from the passage, there could be later phases and maybe sister chromatids can have other forms after or in some other situation. So because it says at any given point, this is going to be false. There are only metaphase chromosomes in the metaphase. If we look at statement 4, S phase occurs before metaphase. Well, here we draw a nice handy picture, and okay, we can see that one's true. It's just like a comprehension question. And then statement 5, in metaphase, chromosomes are dispersed throughout the cell. This is talking about dispersion, so that's kind of our key word. That word isn't mentioned anywhere in the passage, nor is an altered version of the word dispersed, like dispersion or something like that. Instead, we've got to look for the opposite, or like an antonym of dispersed, so something that suggests they're not dispersed, which is the word aligned. So in the metaphase, they're aligned in the center. So if they're all in the center, they're not going to be dispersed throughout. So the answer there is no. The passage actually contradicts that one. So that's my set of answers, being very strict about what conclusions we can draw. Let's move on. Okay, let's look at quantitative reasoning quickly.
I just want to say, and I don't want to spend too long on this, Chris. Let's go snap, snap, snap. Barbara, I think if you do maths, you might find this section a lot easier than the rest. So I'm going to go through it very quickly. 36 questions in 25 minutes. Math skills you would need will be formulas, conversions, interpreting data. All questions are equally weighted, and you will need to use a calculator and a whiteboard. The calculator, unfortunately, is that horrible UCAT one, so you should really do lots of practice, and we teach you a lot more about that on our course as well. So let's move on. You have time management, active reading, and ability to work under pressure as the core skills. And then we've got identifying keywords, inference, logic, drawing conclusions, math skills, and interpreting data as other skills needed. So let's move on. 60 seconds, off you go. There's 2 questions there. Okay, time is half up. So give me 2 letters, 1 for question 1, 1 for question 2, in one answer. Three, 2, 1. All right, it doesn't matter if you have to guess, put your answers in the chat. 2 letters, give me 2 letters, guys. Give me 2 letters. It looks like people have found this actually more challenging to do within the time. Actually, I think I was wrong. I thought this was going to be easier, but we have A, B, B, C, D, B, D, E, B, B, C. We've got loads of different responses. B, C, B, 2, C, oh, C, C, I guess. B, C, D, B. Okay, Chris. Unfortunately, I don't think anybody is correct.
No one's got them both
No
right.
one's correct so far. There's a trick we'll show you here now.
Also, in fairness, if you try and do it with the incomes, it's much harder if you don't have a calculator to hand because they're quite big numbers. So yeah, let's talk about how to do each of these. The first one, so we're looking for a median average income and median temperature. It's worth just noting here. So you got to think how do you find the median? We got 10 things, and the median is the middle number. But for an even number of things, there's kind of 2 middle numbers. So the middle number is like the 5th and 6th out of the list of 10, and the median is going to be the average of those 2. So it's the average of the 5th and 6th highest incomes, and likewise for temperatures. Because you've got to work out both. You can start with either. You've got to decide which to start with. And there's actually a kind of trade-off. So the numbers for temperature are smaller. In general, the technique is it's quicker to start with smaller numbers. There is a trade-off here, because if you get unlucky and they were mean to you with the question, which it turns out they are, you might get 0 for the median temperature, and then it could be C or E, and you haven't actually decided yet. Because these numbers, if it is C or E, the numbers for the income are far enough apart, we could probably decide without doing any more working out which of them is more reasonable. So we'll start with the temperature anyway, because it's quicker. So the mean of the 5th and 6th values. So we need to order the temperatures. So I'll start with the highest, 17. And then those 2 are tied at 3 and 4. The 5th is 0.7. The 6th is 0. So the median is going to be halfway between 0 and 0.7, which is 0.35. Then you have to notice one more thing in the question. So these questions often just test your ability to read carefully and notice all the details. It has to be to the nearest degree. So we ran down to 0. By the way, that means we could see B can't possibly be the answer because it didn't round this one. And so, okay, it is C or E. We have to decide which. So do we have to work out the median income? Because these numbers are quite big, it might take a while to put them in our calculator. But actually, we just have to figure out which of these numbers is more reasonable. So if we look for what the 5th and 6th largest incomes are, the 5th is already 44, and then the 6th is smaller than that. So the median has to be this one, right? The median, the average.
You don't even need to do that work, Chris, because like literally the biggest number there is 52,000, if I'm not mistaken.
Yeah, that's true. So you can just see, okay.
You just cross C out straight away. Yeah.
Yeah. So if you look at the numbers themselves, it's actually bigger than any of the individual values. So it can't be the median. But I mean, even if this was like 49, we would have been able to rule it out. So yeah, we see that the answer's got to be E. They do it. They see. So there's a mixture of they're trying to trick you and trip you up, but they're also giving you opportunities to do things quickly if you notice them. And then this question is mean, question 2. Well, in a way, it's nice because you don't actually have to spend that much time. In a way, it's mean because the answer is E, you can't tell, because they are sort of percentage increase between 2015 and 2020, and then the passage tells you these values are actually for 2016. So you don't have any data for 2015. It was a trick question. And you can't tell because if you don't have data for 2015, you obviously can't work out the percentage increase. So as you can see, they're mean.
Abstract reasoning. I personally find these questions still to this day really, really, really tough. I've been, helping students with admissions tests across the board for many years now, and I still find it abstract reasoning really, really difficult. You get 50 questions in just 12 minutes, and abstract reasoning tests your ability to identify patterns and trends, understand abstract information. All the questions are equally weighted. And each prompt, okay, you're going to see them in a second. So let's just move on, Chris, to the next page. Okay. It's a very, very, very time precious section. It tests the core 3 skills, and it tests your ability to A, avoid assumptions, B, identify patterns, and C, formulate hypotheses. Like, what do I believe? What's my hypothesis for what the pattern is in this set or this set? So, Chris, talk us through quickly.
Yeah, just a snapshot of different question types. So one of them is you're given 2 sets of images. There's something that these ones have in common with each other that they don't have in common with set B, and it's and set B has some things in common they don't have in set A. And you've got to decide which set this one should fall into, but obviously it's different from all of the others. So you've got to identify the pattern yourself. What's the pattern in set A or in set B, and which one does this fall into? Oh, and it could be it falls into neither, which makes it that's a bit hard.
Extra tricky. Yeah, next.
Another one is you've got 4 things. You've got to decide which of them would complete the sequence. So this is 1, this is 2, this is 3, this is 4. It's like it's changing 1 step each time. How is it changing, and which of them completes the sequence? Comparisons. So I was
going to say, a lot of you might remember these types of questions from 11 plus, for example. But I just think that these questions are so much harder somehow. Yeah.
Also, they're more willing to put 18-year-olds under time pressure than 11-year-olds. It's a bit meaner. So there's some relationship between these 2, and this has the same relationship to one of the options. You've got to decide which one it is. So you've got to complete this comparison. Or again, it's set A or set B, but you've got 4 things to decide which set they go into. So you've got 4 tasks to do now.
Okay, phenomenal. All right, so Abhishek, we have only, guys, 30 seconds for the next question. Figure out whether the square on the side fits into set A or set B. Off you go. All right, guys, time is up. Put your answer in the chat. So I've got neither, A, B, B, neither, I don't know, somebody think. Neither, A, B. Okay, we've got a lot of different options going around. I guess, guys, the first thing you have to do is literally figure out what is the pattern in set A and what is the pattern in set B. So Abhishek, do you want to ask I'll let you get on with it, but I'm sure you're going to ask everyone what they thought the pattern was.
Okay, so yeah, this looks like a very confusing thing to initially look at. So the best tip to do initially is to just start with the easiest box. So in set A, which one would you guys say the easiest box is? Just say bottom right or top right, top left, anyone? Okay, someone saying top right, fair enough. And set B, can someone do the same for that as well? Middle right, okay, cool. So yeah, I agree with that. So from what I can see, some squares don't have squares. That sounds a bit confusing, yeah. But some squares don't have squares and some squares do have squares. So that's kind of suggesting to me that the squares are distractors and we can just ignore them. they tend to use a lot of these kind of distractor type things in these questions, which tends to cause students to slip up because they may be overthinking a pattern with the distractors, which in reality it's not involved at all. So if we just focus on the circles in both sets, can anyone seem to see a pattern?
Okay, put it in the chat, guys. Is it in set A or set B that you're wanting them to?
Both.
Okay.
Triangles. Okay.
People are saying triangles. Sorry. Yeah, you read it.
Yeah, no worries. Okay, so yeah, I'm just go with it. So I saw someone say triangles and someone said size. Okay, so the size point, that's another fair enough point. They do tend to use size and like changes in size in some questions, but in this question, I don't think size is the thing they're looking for. It's the shape of the triangle itself. So if you join together the center points of each circle, you can see that they form different triangles. On set A, we have equilateral triangles. Set B, we have other sorts of triangles. And that is the main pattern that we're looking for in this question. So after knowing that, can someone tell me what our question will be, what the answer to our question is? Perfect, nice. Everyone's saying A, great.
Okay, wow, thank you. Actually, Abhishek, that was really clearly explained. Really appreciate that. And I also found it really interesting to learn about distractors as well, which I didn't know about. So thank you so much. Last one, and I'm going to get Jenny to help me out with this, situational judgment. 66 questions in 26 minutes. Testing and understanding of real world situations, ethics, and how appropriate somebody's behavior is. So now we're going to be looking at scenarios in hospitals, scenarios with doctors, other junior doctors, and so on. All questions are equally weighted. Is there anything more I need to talk on that side? Okay, pretty much. So we're talking about professional behavior. This section is kind of graded by, did you do well? Like you get a grade 1 for this section, or did you do really badly? You get grade 4. So yeah, what do we have on the next slide? You need to identify keywords, avoid assumptions, and this is a real life application of ethics. So your understanding of ethics and the NHS needs to be really strong. Prioritizing, if you've got two, you're like, I could do this or I could do that. Both of them are good. Well, which one's better? Figuring that out. And then dealing with conflicting demands, right? Do I look at the needs of the patient or do I look at the needs of the colleague? What's the right thing to do in this scenario? So Jenny, talk us through then, after these guys have had a chance to do the question, 60 seconds, and then if you could talk us through it afterwards. Go.
I just want to say there's going to be 4 things you need to evaluate in this one based on one scenario.
Okay, so you've got 1 scenario and 4 questions. I think you have to answer if how appropriate something is or how ideal it is. Okay, let's go.
Great. So yeah, I'll just read out the question while you guys are doing it.
I think let everyone just read it. I think. Okay, time is up. And in the chat we have, I've got AACD, ABDD, BACD. We've got lots of different options. I won't bother reading them all out. There's been lots of different ways that people have done this. But Jenny, if you could take us through then.
Yep, so I have seen some right answers, which is very promising, especially as this time you guys probably haven't done that much practice already, so that's great. So in general, there are some questions which might be intuitive, but others, such as this one, I think there are lots of points which might not be so intuitive and rather rest on sort of ethical principles, which you may need to have a look at, and the NHS core principles, which would guide you on how to respond in such a situation. So this is one type of situational judgment question. The other type may ask you how important the question is. So here it's how appropriate of the response is. Okay, so for question 1, try to find someone who speaks their language to translate. So the answer for this one is actually very appropriate, because this is the correct pathway of what you would do if you would encounter this situation. And it's all positive, because this is the way that you're likely to find out what the patient's complaint is, and for the patient to understand what you're saying in the most accurate way. And hospitals do provide this. They have translators available. So this would be the safest possible route for the patient. Therefore, it would be a very appropriate thing to do. And you can see here the values which we're putting in: patient safety and well-being is of utmost importance. For number 2,
is it right to say that in general, if an option is telling you like go and ask someone who knows more than you do, it's normally a good thing to do?
I would say in most of the situation, yes, because then you can be sort of confident that you're doing the best for patient safety, especially if it's sort of a superior. There sort of maybe some grey areas where it could be, in some instances, could be appropriate, because there are other tiny things to consider, such as if you're already confident, you probably don't want to be wasting your time, or time is of the essence, that kind of thing. But in general, this type of reasoning would be very appropriate. So the second part, use Google Translate. So she can write her son's symptoms and you can get information across to assess him. So I would say that this part of the question has both positives and negatives. So positives is that Google Translate does actually allow the patient to communicate their symptoms and their complaints to the doctor, and the doctor can then use Google Translate to say their advice and ask necessary questions. So that's a positive. However, a potential drawback is that Google Translate, as I'm sure a lot of you who maybe speak a second language know, and your language teachers will often say not to use Google Translate in lessons because it's not very accurate. So the lack of accuracy could have a potential in compromising patient safety. So I would say, on balance, and this is a judgment that you'll learn how to make, the positives outweigh the negatives, because it is still a solution. It's not the best solution, which is why it's not A. So the answer is B. So number 3, hand her over to another doctor and go to treat other patients. Now, there are lots of questions which this is a common theme that comes up, which is if you can't deal with this, your workload, go get another doctor, or if you can't deal with this, go get another doctor. It might be positive in that you're sort of seeking help and you're not sort of overburdening yourself. But in this situation, it's the language problem. You're not actually dealing with the problem, you're just offloading it to someone else. And the other doctor may very well face the same issue. And actually, in offloading this to another doctor who might be very busy, you're just delaying the patient in being seen, which, if the patient has sort of a pressing issue, would not be the safest. And it's also not very good in terms of team spirit, teamwork. Okay, number 4, do a physical exam without listening to the boy's symptoms. So on the face of this, this seems quite inappropriate, because there's only so much you can get from a physical exam. But whereas a loss of key knowledge or key information about the patient would be coming through verbally and by asking questions. So this is definitely not very appropriate, probably is not appropriate but not ideal either. However, if this were sort of a pressing case and you couldn't get a translator in time, then you would still be able to pick up some of the physical symptoms that might be sort of time pressing that you could refer on. So it's inappropriate, but essentially it's not an awful thing to do.
Okay.
To answer a couple of quick questions in the chat, you can get partial marks for these questions. Also, it is just saying they can't describe their symptoms, so we shouldn't assume they can't communicate at all.
How do you prepare? Preparing for the UCAT. Okay, as I've said already, do an intense number of questions and we will provide those for you. Untimed mocks and then time mocks. Practice keyboard shortcuts, practice with a calculator and whiteboard, practice quick arithmetic. Observe and focus on question types that you're weaker on. Learn specific tricks and tips for different question types, and that's something we're going to be covering a lot. A lot of this is going to be in our course, but something specific we're going to be covering in a lot of detail. And learn ethical rules for the situational judgment section. So, are we ready? Oh, planning your UCAT prep. Do make a schedule. This far out, I don't know if anyone else is going to be focusing on this slide, or if I'm just talking about it. Chris, were you going to?
I can talk about it if you want. So, the idea is that, okay, at the beginning you just focus on like learning the different question types and getting the techniques right. So you're doing more untimed mocks, and then closer to the real thing, you start doing time section mocks or timed full mocks. You can, I mean, a lot of candidates spend up to 3 or 4 hours a day at the very end, just before UCAT, because like, lots of practice is important. But immediately before, you shouldn't over prepare. You do need to be relaxed for the real thing. Abhishek, do you want to just say something quickly about how you prepared? Does this sound like what you were doing?
Yeah, sure. So yeah, I think this is pretty much what I did, and I say it was quite effective. Like starting like kind of easy, I guess. Taking it a bit slow, make sure you're getting used to all the basics, make sure you can do all the questions untimed. And when you're confident in your abilities to be able to do the questions untimed, when you're confident that you've learned the skills that you need, that's when you focus on doing the timed, because it's important. It's good if you can do the questions and if you can understand them, that's perfect. But to be able to get a good mark in the UCAT, you need to be able to replicate that in a very time pressured condition, which is why timed mocks and timed section mocks are so important, and that's why you need to really be focusing on those. So like Chris has said, I completely agree with that. That's exactly what I did, and I'd say it really helped me get my score up. So yeah.
Great, thank you. If we just show a couple of more details. So we tend to ask our students to do 5 to 6 hours of additional work per week. This is like over the summer when you'll have more time.
I mean, that's during term time, to be honest. I would say during the summer, we'll be looking, as you said, starting a little bit lighter, but then working up to 3 to 4 hours a day closer to the UCAT exam.
Just to show a quick plan. So it's useful to plan, okay, what am I going to do this week, but also what are my goals for my progress? So you can see that might include goals for what you're going to score in your mocks. Maybe you've got a particular section you're focusing on, what are you going to score in that section, like here SJT for the student. And then think, what are you going to focus on in order to help you achieve that? So at the start, okay, you get an intro to the UCAT, maybe you do some untimed questions. You're doing untimed mocks at the start and time mocks later, as we were saying. You might also say what sections you're going to focus on this week. We put here, okay, maybe someone's attending a UCAT summer course, just like the one we're running. So they might do some extra practice on that. And that includes maybe practicing the interface, like the calculator and the flagging tools and so on. And then also think, like we said, okay, if you're doing 3 to 4 hours a day, maybe with weekends off, that might be 20 hours a week. But you ramp up to that, as we were saying. So apart from when you're doing some intensive course or other intensive prep, you're starting with lower amounts of hours per week and then working up towards that.
And by the way, if you can do more, you might want to do more. These are just kind of minimum recommendations, you know, like nobody's stopping you from doing what you want to.
Yeah. It's also assuming you're doing other things like work experience, maybe other prep. And an example weekly timetable, just to talk through this quickly. So if someone's, go on.
Is it when somebody's at school? This is in a typical school week.
Yeah, this is like school week. So most of the day you have free for other things. This person, they go into a workshop. Like we run weekly workshops on Mondays. So it might be some prep work to do beforehand, and then they come to the workshop in the evening. Then they'll do a timed mock maybe, or an untimed mock, depending on the time. When you've done a mock, in the online question bank, once you've done a mock, you can go back and analyze the questions, like which ones you got on the right, what the answer should have been and why. It is worth, if you didn't finish all of them, maybe doing some unattempted questions afterwards, sort of as untimed questions, just to make sure you practiced all the questions, you haven't wasted any. Then afterwards, you can do that analysis and make a cheat sheet of like what you learned from seeing these questions, techniques that you could, and question types that you've learned about that you can maybe answer better in the future using the techniques you've just learned. And then perhaps this person has tuition at the weekends. So they also have some practice questions to do beforehand, maybe homework from the previous session.
Okay, fantastic. So that brings us pretty much to the end. Let's move on, Chris. Q&A time. So Jenny, Abhishek, get ready. And we're going to be throwing lots and lots of questions at you. So somebody says, I have a question that's not relevant to this talk. How do I call you? Well, you can, once you sign up on that link, there'll be a place where you can book a call with us. So I think that'd be a great thing to do. How long is the how long is the webinar? Okay, well, we're coming to a close soon. Right, what A-levels did the first speaker, the founder of the Oxbridge Formula, do? Now, I'm not a medic, so it might not be relevant to you, but I did maths, further maths, physics, German, and French AS. What are the main differences between the UCAT and the BMAT? I think we've covered that one, but what I will also add is the BMAT covers science, rather than just kind of problem solving, critical thinking stuff, and it also has an essay. We have run a medicine workshop before where we briefly did talk about this. So what I'll do is I'll ask one of my colleagues, Ben, to email you all access to that webinar if that would be helpful. Predicted grades for Oxford or Cambridge medicine. Abhishek, do you know, or Jenny, do you know what the what were your predicted grades? I think they're specifically asking.
Do you want to go, Jenny? Or?
Oh, sure. So the predicted grades, they don't actually matter unless they're above. So as long as they're above the minimum requirements, they don't actually matter. Because I was speaking to an admissions tutor and they said that a lot of schools do inflate the grades. So you don't have to have perfect grades like 5 A stars or whatever to actually be able to apply. You'll be equally strong with an A star and 2 A's, which is for A levels the required grade for Oxford. And I believe for Cambridge it's A star, A. But correct me if I'm wrong there.
Okay. Somebody said, I thought they give you an actual simple calculator in the UCAT, like a real life one. Is that still true? Abhishek?
No, I mean, I don't think so. For me, at least, it was an online calculator, and I don't see why they would change. But I can look that up and like maybe I can look that up now, to be honest, and I'll get back to you. But I really doubt it.
I'm 99% sure it's still the online calculator, unfortunately, which is horrible to use. So somebody said questions not in the chat, please, in the Q&A box ideally. I've got almost 100 questions, so I'm going to go as fast as I can. I've got the time. Have the timings or number of questions changed because of COVID? Does anyone know the answer to that question?
Not that I know of.
Yeah, not that we're aware of.
I'm on the UCAT official UCAT website. It's still a simple on-screen calculator, so it's nothing in. You don't have one in person.
Okay, excellent. Somebody's asking, do we choose the date and time of the course when they pay? For the UCAT course, we only have one July date, which is the only one we've got open at the moment. So there's only one option, and all the information will be when you click more details. Hopefully, Charlotte can just confirm with me all that information like date and time, etc., should be on that page. I'm sure she'll confirm in a second.
Yeah, everything's there.
Okay, excellent. So you can find all the dates and times once you've registered, and you'll get sent the page with all the details. Okay, somebody says I registered with the UCAT, but I haven't paid anything. When do we pay? Jenny, can you answer that one for me? Do you know? Do you remember?
I recall that I paid when I booked the UCAT, so just make sure, they might have changed it, but just make sure that you have actually registered, not just sort of registered interest or something.
Okay, that's a very helpful tip.
They
How
will
much-
be on the website.
Yeah. Okay, great. How much revision do you need to do now? I think we gave the minimums there. You want to start off with 5 to 10 hours a week and ramp up to around 20 hours a week, I think, for UCAT. If you start right now, start early. You know, we've got a bit of time. If you do 5 hours a week for the next 4 or 5 weeks, well, until holidays start, then that's absolutely fantastic for you. And then you'll be able to ramp it up. And by August, beginning of August, maybe you'll have a really good shot of getting a really good score. So that'd be great. Okay. For A levels and GCSEs, they get rest breaks. Is that possible for UCAT?
I don't know the exact details. There is a separate UCAT, as I said, UCAT SEN for people who need any kind of accommodation. You need to look at the UCAT website to figure out if they've got exactly what you need. But I imagine they would try to accommodate you.
Okay. Summer courses, masterclasses, and tutors. Where do we apply for it? If you go to that link, the QR code that's on the screen right now, register your interest there. You'll be emailed all the details, and then you can sign up. Which year should the UCAT be taken? It's normally taken in the summer between year 12 and year 13, or just in the summer before your application. How does scoring work? I think we've covered that. UCAT summer course is targeted for year 12. It can be year 12 or year 11. I mean, none of the skills are A-level based, so if you wanted to come early, no problem. In terms of costings, all of that information can be will be emailed to you once you register on that link. Do all universities have a minimum score needed for the UCAT? Jenny?
So no, they don't all have sort of cut-offs. Some schools have cut-offs sort of for particular sections and average. But a lot of schools will just sort of rank you, and then depending on the year, it will either be just UCAT or sort of as a whole. They'll assign you a certain number of points, and taken as a whole with your personal statement and potentially your interview, or before interview, they would then choose successful applicants or applicants for interview.
Okay, great. Abhishek, do you have to be really smart to be able to get a high score in UCAT, or is it based on how much practice you do?
No, I guess you guys are all smart in the first place. If you're wanting to study medicine, it's a really competitive course, and like obviously you guys must be very smart to be able to take that in the first place. But secondly, no, I don't think the UCAT has anything to do with smartness, because I guess like it's just skills that you can work on by practicing, and if you do enough of it, you should like genuinely just be good at it. The more questions you do, you'll work yourself up. So if you follow that revision plan that we put up, or work even a bit more than what we put up, you will be 100% fine. You don't need to be smart to be able to do good in the UCAT. As long as you do your practice, get your skills up, make sure you can work well under time pressure, make sure you can work well under the time conditions of the exam, then you will be all fine.
Okay, fantastic. Jan, so I put a question in the chat for you, if you could find the answer out for us. Can you resit UCAT? I believe not within the same year. So you can only sit UCAT once per year. So make sure you are well prepared for it. Okay, the website mentioned during strategic applications was What Do They Know? It's the Freedom of Information website called What Do They Know? Does BMAT test us on only year 12 content, or is year 13 content included as well? I believe year 12, if different, let me know, guys.
I think it's just GCSE for sciences.
Okay, cool. For dentistry, I've heard not many unis do BMAT. Which unis do ask for BMAT? I actually think for dentistry, it's only UCAT, if I'm not mistaken, Chris. Yeah.
As far as I'm aware, yes.
Okay. Can you retake the UCAT not in the same year? Do you need to do the UCAT for a paramedic degree? That's a good question. That may be one that we, does anyone know for paramedic degrees?
I went through the list of degrees. I didn't see one that looked like a paramedic degree, but I could have missed it. It is possible.
Okay, well, I think we'll just doubly check that one and come back to you. All right, so Abhishek, unfortunately, needs to leave, but best of luck for your exam, and take care. Thanks so much for your help.
Thank you.
If you would like to be taught by Abhishek, he is a phenomenal tutor, and I think his explanation of just that one question was really, really good. All of our students absolutely love him, so you'll get to be taught by him in the UCAT course if you do join. Would it be smart to apply to a uni that requires a lower UCAT score if you have quite a high UCAT score to maximize your chance of getting in? Jenny, what do you think?
So I would say that you could. So again, the UCAT score with my table earlier, it can either depend on whether the university is, how competitive it is, or how the UCAT is weighted alongside the other components. So I would definitely check that for your chosen uni. And if it's the former, so how competitive it is, if it's a lower UCAT score requirement, that might be due to it's less competitive, then I would say yes, go ahead. But then on the other hand, if it were that it was weighted less, then potentially then you would have sort of less of an advantage, but it's always definitely an advantage having a high UCAT score. And if that's a university which you really want to go to, then I would say go ahead.
Okay, wonderful. Thank you so much. I just have confirmation from Jansu that BMAT is in September, is not happening in 2022, only on November the 2nd this year. So next thing, can you reset the UCAT the next year? I believe you can, Jenny. Yeah, okay, great. Are there any exam arrangements, e.g. extra time? So there's an exam called the UCAT SEN or UCAT SEN. So I think honestly, I don't have too many details on that. I don't know, Jenny, if you do, but if not, then that will be the thing you need to look up, UCAT SEN, and that can give you more details.
Yes, and definitely that's something that your school extra time arrangements. Normally there's a specific person who's sort of in charge of extra time arrangements at school. They should be able to sort it out for UCAT SEN as well.
Okay, excellent. If you're not an international student, can you apply to Manchester with the UCAT? I think Manchester is a UCAT uni, correct?
That's what I thought, yes.
Yeah, okay. Could you please tell me how to find out the selection criteria and cutoffs for the unis? So I think I'll just summarize that you can find them on some of the websites, and if they're not available, there is this website called What Do They Know? And a lot of people have asked these questions before, so you can go through previous questions or even ask your own. So that would be what I would recommend for that. How much does summer, is the summer course free? Unfortunately not. No, it's not a free course, the one that we're running, but you can find out more details. We emailed all the details and everything to you if you registered on that little form. Somebody says they're in year 11. Would the UCAT summer course be? Oh, I think I've already answered that one. Yes, absolutely. Like if you can learn it all a year in advance, why not? You know, there's no harm. There's no A-level knowledge required, so that's absolutely fine. Is the UCAT the same for medicine and dentistry? Yes, absolutely the same. Does the summer school have dentistry UCAT questions? The questions are all the same. There's nothing kind of different between the questions asked to medics and dentists. So yes, absolutely. What A-levels did you do, Jenny?
So I didn't actually take A-levels. I did the International Baccalaureate,
Okay.
but I did high level chemistry, biology and history, and then standard level maths, Spanish and English. Okay,
unfortunately Abhishek's not here, so we can't get his answer right now. Can you get into medicine, I guess, with a AAA and high UCAT 2700 plus, or do you need higher predicted grades? What would you say, Jenny?
So it depends on which university you're applying for. So some universities, AAA is the minimal entry requirement, but for Oxbridge and some other universities, it's slightly higher.
Okay.
And I think that's a decent UCAT score, definitely.
Excellent, excellent. Somebody's asking if there are any dentists or dental students. We do have dental tutors, but unfortunately none of them are available to join us today. But it's the kind of thing that if you were to join our program, you would have access to those tutors and you would be able to ask questions to those dentists as well. If you're entitled to extra time, will this be allocated during, I think we've already covered that one. Some questions, if they were answered in the webinar, I'm not going to mention right now. Okay, what is one way you found that helped to deal with stress around preparation, Jenny? What would you say?
So I would say before you go into the actual UCAT revision period, it's useful to have planned roughly what you're going to do each day. So in the slides earlier with the course, how they've planned everything out, that's actually really reassuring, because I find that when I'm really stressed, it's when I'm overwhelmed sort of 2 weeks before, and I don't think I have enough time to cover that much. But if you sort of plan that before, or do something that, like the course, which is sort of planned out for you, then I think that reduces the amount of stress. So that's sort of course-wise, but the most important thing is not to just do UCAT all day, all night, to make sure that you sleep well, eat well, and have sort of hobbies outside of medicine preparation in your school subjects. So go sort of have a picnic with friends on occasion, and having a good work-life balance is really important all throughout school and university.
Okay, wonderful. Somebody says the UCAT website recommends 6 weeks of preparation, 1 hour a day. Do you agree with this revision time? What would you say, Jenny?
I'd probably say that's potentially underestimating it a bit, because just 1 hour a day, well, it depends on what type of learner you are, how good you are already at each of the sections. But I'd say if you sort of start off by doing a mock, and then you identify sort of how good you are. So actually, when I started, I was quite bad at a lot of the sections, especially quantitative and abstracts, which ended up actually being my best. But I knew that I needed a lot of work on those sections, so I had to spend a lot more time than was recommended. But it was by person.
Well, I mean, look, you spent a lot more time than was recommended, and you got an absolutely phenomenal score. So I think what I would say is, if you just want to be like everybody else and you want to get an average score, then do the 1 hour a day. If you want to like really get that high 2,800 plus score, then you're going to probably have to do a little bit more work. And you know, they're trying obviously not to overwhelm you, but it's a competitive test at the end of the day, and the within reason, the more work you put in, the better result you're going to get at the end of the day. So that's what I would say on that one. Somebody's saying, what do you mean by prompt? You know, normally if you have to read something and then answer the question, the thing you have to read, Chris was referring to as a prompt.
It could be called a question stem. It depends on the context.
Okay, if you're already part of our program, don't worry at all. We'll give you all the information. Somebody's asking who's already on our program. Would you recommend going straight to the questions without skimming the text and then going back to look for keywords for verbal reasoning? The questions seem to be in order of paragraphs in each passage.
So for verbal reasoning, how I tend to do it and sort of teach it is you go through the questions first, pick out the keywords, and then go back through this for the text. So
would you look at the text first at all?
I would look at the questions first.
Okay, fine. So you can either skim, look at the questions and then figure out, or you could look at the questions first. I think personally, I feel like if I have a bit of an idea of what the text is going to be, then the questions make more sense. And I'd be able to kind of remember them and comprehend them better. But I guess, yeah, I think you have to understand how you learn best. Okay, the summer program can be, I think, for year 12 or year 11 students. Okay, a lot of these questions have been answered. So what were the tips for quantitative reasoning? Chris, do you remember what those tips were that you had put on that slide?
Go back 1 second.
Maybe check on the PDF that you sent for a sec, or somewhere else.
Yeah.
I'll come back to you in a second. How do you know what a distractor looks like? Now, this is something that we will be covering in our courses, and Abhishek, who is our resident abstract reasoning expert, or the one who is going to be teaching that, isn't here right now. I'm sure Jenny can give us more details, but I think we'll wait for that course to give you more details on that, just because of interest of time.
Just the tips for quantitative reasoning were start small, so smaller numbers, compare sizes of numbers, look at the options first, tells you what calculation you might want to do, and read carefully. That was the one where there was the trick question, so read carefully.
Okay. Somebody asked, in the situational judgment, does each prompt's question, okay, in situational judgment, say you've got very appropriate, not appropriate, very inappropriate, whatever. Can those options be used more than once in those 4 prompts?
Yes, definitely.
Yeah, okay. It just so happened that these were the ABC, DC, but yeah, in general, you would be able to use them more than once. Okay. In the situation judgment question, how do you differentiate between inappropriate, not awful, and very inappropriate? Handing her over to another doctor shows you know your competencies, and the patient can find a doctor that perhaps knows the same language. I would say, and Jenny, I'll let you speak further if you want on this, but I don't think they were handing them to another doctor because that doctor knew the language. It was just like, I don't know how to deal with this, I'm going to hand it off. That was the impression I got, and that's the reason I think it's quite an inappropriate thing to do.
Yeah,
then,
the very inappropriate was from actually that you're prolonging the time that it takes for the patient to see someone. So yeah, that's compromising patient safety, and that's why it'd be very inappropriate.
And then they say just doing a physical exam risks misdiagnosing the patient and leading to serious harm to the patient, and the patient health always comes first. So I think we were wondering
that question, presumably after just doing the physical exam, they probably wouldn't come straight to a diagnosis, but just do a physical exam immediately and look for sort of warning signs or any emergencies, and then sort of at a later point consult a translator. Of course, they didn't say that, but and that's why this would be inappropriate, but not awful, but not very inappropriate, because you're still doing something rather than just sort of prolonging it and handing it off.
Okay, fantastic. So should I just do BMAT, not UCAT? I think we covered that earlier on. So what we're going to do, we'll send you a recording of this webinar, and you can have a look at that section again. I'm just conscious of time. Sorry about that. At the end of each section, does the UCAT tell you the score, or only the combined score at the end? Only the combined score, Jenny? Combined
Score at the end.
So you don't know what you got in each section?
You will know sort of after the whole thing, but it doesn't tell you, for example, after each section. So afterwards, I think they sort of hand it.
So what you're saying is at the end of the test, you find out your score for all 5 sections individually.
Yes, and they sort of print it as a slip to you and hand it to you when you're walking out.
Okay. What are the most common mistakes made during UCAT prep? Ooh, can you think of any, Jenny?
Not leaving enough time. I know friends of mine who have started UCAT prep 1 week before. That's definitely the biggest mistake. And also not doing any practice under time pressure, because it's very different under time pressure and not under time pressure.
Somebody's saying, excellent, thank you. Am I disadvantaged if I do biology, chemistry and business studies instead of maths?
I mean, I didn't do high level maths.
Okay, that sounds good. Do Oxbridge look at the EPQ in any format for the admissions process? The only thing I would say to the person who asked that question is, if you haven't done maths A level, then you might find the maths on the BMAT not hard, but like something you have to go back and revise if you're doing the BMAT. And similarly, maybe some questions on the UCAT, but it's just for a lack of practice rather than the maths at A level being relevant. Do Oxbridge look at EPQ in the admission process? I would say yes. If you do, I'll ask Jenny, but I've heard yes, it's a useful thing to have in your personal statement.
Yes, so it shows lots of sort of, because in Oxbridge we're examined in medicine by essays, and it shows sort of being able to formulate your thoughts. So it's definitely a good thing. They won't necessarily ask you about it because they like asking you about things that you don't know much about, but I think it's definitely a valuable thing. But also you have to consider sort of the amount of time you might have to spend on it and balancing your other subjects and these admissions tests.
Okay. And somebody says, how did gap years, sorry.
I think we discussed this some more in the medicine webinar that we didn't before.
Okay, yeah. We'll send you all out a link to that webinar in the next 2 or 3 days, so look out for that. How did gap years work if I want to apply to Cambridge or Oxford after a gap year? Is it more difficult? Jenny, do you know about that?
Deferred is very, very difficult, but if you apply after your gap year, lots of my friends in my year have done that, and often they've done something medical related in their gap year, and it actually allowed them to sort of complete their A levels or IB and then dedicate time to doing the admissions test and the interview, sort of separate from that. So I would say it doesn't put you at a disadvantage. It's up to personal choice and circumstances.
And what do they do during their gap year, your friends?
Well, it depends. Some of the more studious ones, that sort of research projects with the university, some of them volunteering, some of them sort of just working, some of them traveling. So really varies.
Somebody
Get a bit of sort of work experience during that time, or volunteering since you have the time.
Okay. Somebody says, I've heard that people can peak if they over prepare for UCAT. Do you believe this is true?
Probably not. I don't see why you would get worse, but there is sort of the more preparation you do, probably the more you would do better. But with your medicine application, there are so many different parts that you mustn't just focus sort of single-handedly on the UCAT and forget everything else. Also, there is something called burnout. So if you work too hard on anything and then burn out and then you're too tired to actually perform well in the BMAT, that's in the UCAT or the BMAT. So I can see in that case, yes.
Somebody's put in the chat here, thank you. For dentistry, you only Leeds requires you to take the BMAT. That's somebody from our audience is saying that. So that might be something we want to look into if you're a dentist. Okay, we've done that one. I don't think pharmacy needs UCAT as far as I'm aware, but if we could just double check that one as well. What should I focus on my personal statement to Oxford and Cambridge, Jenny?
So academics, supercurriculars, your extra reading. I think they normally recommend 80-20, so sort of 80 academics and 20 sort of everything else. But it's important to know that you won't just be applying to Oxford, you use the same personal statement as all your other medicine universities. So it's important to have a balance and to talk about things such as work experience, medical ethics, volunteering, and your key skills. That's all very important as well.
We actually have a Oxbridge medicine webinar that we've run before. Again, that can be something that we can send out to you if you'd find that helpful. Do unis look at your grades or overall UCAS points that your grades add up to? I think they do look at grades. You do have to have the minimum predicted grade requirements, I believe.
Depends on the subjects and the university, but for medicine, all of the ones that I've seen have been looking at grades.
Okay, what is it like studying in some people are asking about Oxbridge, and we have a whole webinar about Oxbridge medicine. So what I'm thinking is if we get that sent over to you, a lot of these questions you're asking will get covered there, if that's okay. Just because I'm, again, just conscious that people have got school and stuff. Yeah, we've got some people asking, where can you find extra reading recommendations? Somebody's asking.
If you go on the Oxford Medicine extra reading section, they do actually have a reading list. I wouldn't recommend all of it. A lot of it I read and it was extremely boring. Didn't take anything from it. But there
what was your one favorite book that you read and you were like, that was really useful?
I read there was the one by the Junior Doctor by Adam Kay that was very funny and it's also a very easy read. Henry Marsh's Do No Harm is probably slightly more academic one. But I'd say only read something if you actually enjoy it. Don't read the anatomy textbooks.
Somebody's saying in the chat the book is called This Is Gonna Hurt.
Yeah, exactly.
Turned into a TV show, I think.
Huh?
It got turned into a TV show, so maybe you can just watch that.
Yeah. I think probably better to read the book and watch the TV show. And somebody said for UCAT, do you need roughly the same scores for medicine as for dentistry? If you remember that table we showed you with the different columns, I believe it's very similar between dentistry and medicine. Yeah, so the average score for dentistry in the UCAT in general is a little bit lower than for medicine. It's just under the 2,500 mark, it seems. Although it is very competitive, so that surprises me quite a lot. Yeah, okay. Well, look, guys.
Anyway, that's like 5%. So like difference between being top 20% and being top 25%. Is that kind of cap? So it's not that big a difference between dentistry and medicine.
Good stuff. All right. Cool. Right. So I think that brings us to the end. So lastly, we have nearly 100 people here still. Thank you so much. Huge thank you to Chris, I would say, who has put together this presentation and has done a phenomenal job, I believe. Thank you very much in advance to Abhishek and Jenny, who also really helped us with the preparation and did the Q&A at the end. And thank you to Jansu, as usual, for being extra supportive. And I think a lot of you are going to be booking calls with her as well as the whole Oxbridge Forum team. Actually, a lot of effort has gone into this. So we will all appreciate your appreciation. As somebody says, great job, team. Oh, thank you so much. So take care and have a good evening. Bye.
Bye.